So thank you everybody for joining us this morning for the sixth in our series of webinars. So I'm really pleased that today we're going to be talking about connecting people to best practice. We are delighted to be joined by Samantha Unamboowe, who will give us an overview of a project that she's been involved in, developing an innovations database to do just that, connect people to best practice. I'm Alison Day. I work down in Poole Hospital. I've also got a secondment ongoing at the moment where I'm working as project manager for Knowledge for Healthcare, specifically looking after mobilising evidence and knowledge and assisting with that work. A bit of a mixed presentation. Well, I'll do a little bit of introduction and then obviously hand over to Sam to tell us a lot more about the database. So we're going to explore connecting people to best practice, as I said. And we'll talk a little bit about a project that was conducted by a small team of librarians who met in 2016 and finalised their project in 2017, about how they could get involved in using some knowledge management tools and techniques. And they were specifically set a particular challenge, and I'll move on to that in a moment. So both I and Sam were able to be part of that little group. And obviously Sam has then taken this work forward and developed a fantastic database to share innovations around her organisation, and actually was successful in winning the 2017 Sally Hernando Innovation Award. So really delighted that Sam can be with us today. So just as a recap of what connecting people to best practice means, so within the Knowledge Management Toolkit, which you can find on the Knowledge for Healthcare blog, lots and lots of ideas about using various knowledge management tools and techniques. And connecting people to best practice is described as using knowledge to inform healthcare policy, knowledge sharing to spread the learning, embedding best evidence into practice, supporting innovation, meeting information needs of staff and patients, and promoting actionable knowledge tools. So that just sets a little bit of context for the actual database that we'll be using today. And here's a lovely group of people that I had the pleasure of working with throughout from February 2016 to February 2017, which is when the program ran. We were set a project to do as part of this leadership program, which was really about how we could connect people to best practice, and that was our challenge. And you'll see in the photograph, you've got going from sort of left to right at the back row, you've got Chris Johns, who is based down in Cornwall. You've got myself, based in Poole. You've got Emily Hopkins, who was our project sponsor, who's based up in the northwest, sorry. She'll hate me for saying northeast. Tim Jacobs, who some of you may know, who's done a lot of work around using Windchill, the Interlibrary Loans module. You've got Ao Ogundupi, and then on the bottom row you've got Joe Alcock, who was our facilitator for the whole of the programme, the great Joe Alcock, I think we always have to say now. Kay Bagshaw works over in London, Sam, who's going to be joining us today, who's centre stage in that photograph, and Carol McCormick, who is in the northeast. So it was great to have people from all across the country to work together on trying to find a solution to this project that we were set. And this was the project. We were asked to devise a database to encourage people in an organisation to share best practice and innovations. We already knew about several national and international databases, but our scope was really to encourage sharing at an organisational level, just so that things would move beyond individual wards or departments to benefit the whole organisation. We actually extended the project scope because we were all new to knowledge management. We lacked confidence in using knowledge management tools and techniques. And we thought it might be quite useful to have a step-by-step approach for somebody new to knowledge management so they knew how they could get started. Sort of practical things about how to use some of the tools, who you might need to go and speak to, and just share our experience of trying to get some of that up and running. We particularly focused on the capture, storage and sharing of knowledge around best practice and innovation. Everybody involved in the project, we did a little review at the end. We all said that by using the tools in the toolkit, we came to recognise the value of doing knowledge management activities. And we saw this extension of our role as being highly rewarding, really valuable and very, very enjoyable. So we were kind of converts, I suppose, to using knowledge management tools and techniques in some form or another. The full model, the report of our experiences can all be found on the Knowledge Management Toolkit, and you've got the link there. And these slides will be made available at the end, including also a recording of this webinar. So Sam was probably the most successful in the group in terms of actually taking this full circle and actually then creating a database. And that's what we're going to find out more about today. Okay, so today we're going to use a knowledge management tool which is called a knowledge exchange. Knowledge exchanges often take place when somebody is leaving an organisation or leaving a project to make sure that you've gathered any information and understood their point of view, understood their tacit knowledge and gathered that together. But we're going to use it today in a different way to actually find out more about somebody's experience. So it's a good way to pick up tips and understanding. And it can be done in quite a structured way. There are different ways of running a knowledge exchange, but today we're going to do it in quite a formalized structure, and it's slightly false because we would, in an ideal world, have consulted with you all and asked for your input into the 10 questions that we're going to ask our visitor so that we can learn from their experience. Unfortunately, I had to do that in a little bit of an echo chamber and come up with questions myself. But do feel that you can add questions throughout this presentation. Send them to me as host too, using the chat window, and I'll happily make sure we've got quite a big section at the end for questions. I'll make sure that I've filled those to Sam, so there's plenty of opportunity for you to get involved and ask your questions about the database too, or indeed about the project if that was what you were interested in. And then Sam or I can answer those questions, hopefully. So as I say, you can do a knowledge exchange in various different ways. We've done it in quite a structured way, coming up with 10 questions, and then the person that we're asking those questions of also comes up with 10 questions so we can start to compare experience. And there will be some overlap between those questions. And Sam's unable to give us a live demonstration of the database, but she will talk us through using a variety of screenshots how the database came into being and was set up. So don't forget, don't save your questions to the end. Keep sending your questions through as we go through the presentation. Here are the 10 questions that I came up with for Sam that I thought we would probably like to hear about. And what I'll do is I'll introduce Sam properly in a moment, and we'll gradually start to ask these questions as we go through. So be mindful if that's what we're going to try and cover in this session. And these are the questions from Sam for us. So there are some things there for us to think about. And I think probably at the end of this presentation, it would be well worth revisiting these slides and really thinking about these questions from Sam to help you think about, is this something for me to do locally? Is this something I could help to set up? How would I get involved? What would be my hurdles, and how would I overcome those hurdles to actually getting this started? So some useful questions there to help us. And if we've got time as we go through the presentation, we may start to answer some of those questions using a whiteboard function. But I'll describe that as we come to it if we get time to come to that. And Sam works as the Library and Knowledge Services Manager at Royal Brompton Harefield NHS Foundation Trust. Sam, can you hear me?
Yes, I can. Thank you, Alison.
Lovely. So welcome, Sam. Thank you so much for joining us. We're really delighted that you can be with us on call today. And I don't know if you'd like to, perhaps before we go through a full demo, would you like to just tell us a little bit about how you got started on this and who do you approach perhaps with your idea to create an innovations database?
Yes, I thought we could start with the questions that you had for me, the question slide.
Okay. Yep,
2 slides ago.
Let me go back to those. There we go.
Oh,
okay.
Yeah.
There we go. So, yeah, who did you approach with your idea to create an innovations database?
This was an idea that I had for a long while, and as I was, going about my daily job, I realized that everything starts at a literature search in the library, and I knew what was going on in the trust in respect to that. So I'm also part of a medical education committee here and the medical education board. So the medical education committee consists of doctors, and the medical education board is all the health professionals that practice here, and I talked about it at these meetings, and they felt it was a good idea, and they said to me, go for it, since I was also already on the leadership course, and that was the focus of the course as well. So the Medical Education Board, some members on the Medical Education Board also sit on the Trust Board. So they're the ones, the Director of Strategy, who said, do it and see where you get with it. So I started to get the process going. At the Medical Education Board meeting, people gave me names of other people who might be interested, and I contacted them, and they gave me other names, and so it became a whole network of names, and everybody I contacted and spoke to about this was happy to do it, because it was for them a platform to showcase their work and to share their work with others, because we are a hospital trust on 2 physical sites. So, and the clinicians that I contacted were happy to do so, because it is a way to showcase their work, because they do put in, it's a poster, it's an A3 poster, but there's a lot of work that goes into making that up, a lot of research. And they were also able to connect with people cross-site. So we are 2 hospitals 20 miles apart. It's not often that clinicians get a chance to share their work with each other. So this is now where people can share what they do, and people can look at what is going on and adapt it for their purposes. And also because somebody has already done the research, what's on there it can be rolled out in other sectors without needing to reinvent the wheel every time. So how long did it take to set up? We started, I had the initial conversation in April, and by August, the database is set up and populated. So I'll just work my way through these questions then. And then the third one is, did I need lots of technical expertise? I had a lot of help from IT. The IT department, the web editors, so I was tapping into their expertise to create the structure of the database. Regarding how much time a month does it take to keep up to date, I'd say not more than a day a month. The content on the database comes from, in our trust, the nursing cohort have what they call a compassionate care program, and as part of that they do research and present their findings in posters. The junior doctors, CMTs, they need to do projects and present their findings in posters. Allied health professionals also need to do this. This is all part of their CPD as well. And then we have people in the trust who present their work at international conferences. And if they don't write a journal article about it after presentation, that information remains as grey literature on their USB stick, which comes back to the trust. So that's where that's how we populate the database. Everybody knows about the database, and they know as a matter of course to, once they have created a poster, once they've presented it at their competitions or conferences, it all comes through to us. And these competitions happen annually. We also have a quality improvement competition as well, where all health professionals can get involved and do their research. And the focus of all of these projects is to improve patient care.
So you're very much sort of gathering work that's taking place anyway and keeping a record of the outputs. Is that fair to say?
Yes, because otherwise, without this, they'll do all this work, and then that work then remains in the department on a USB stick, on a rolled-up poster somewhere in the bottom of a drawer, forgotten, but it has valuable information that could be of use to someone else. So we are making that discoverable.
Super. Thank you. And does it need lots of encouragement to get people to add entries or make use of the database?
No. Once the idea spread, it's now become a sort of a who's who. People are always checking out to see who's on there, and there's also I suppose a competitiveness. So the nurses feel there are more nurses than doctors, therefore the database should have more of their content than the doctors, and the doctors feel they do not wish to be outdone by the nurses. So yeah, there's a bit of a healthy competition going on there as well.
And you probably try and encourage that, I guess.
Yes. But I think this database is, because they have now staked an ownership in the database. It is their database. Mm-hmm. You see, the library is just hosting it, but this database is their database. And when it becomes theirs and they have the ownership of that, they are more interested in growing it.
So you see your role really as facilitator and assisting to actually get the information in a position where it can be shared with everybody else.
Yes.
That's the real role for the library. Yeah, lovely.
Yes, exactly.
Do you think it has had an impact on the spread of ideas and encouraged people in your organisation to contact each other more?
Yes, I've had a few instances of this, but we also we do an annual user survey, and in that, there's going to be one of the questions we'll be talking about the database and asking people how it impacts on them, what they do with it. Mm-hmm. So one of the posters that one of the nurses did was to do with sunshine and the value of exposing a patient to sunshine and which then has an impact on their recovery rate. The people can recover quicker, the body recovers quicker when exposed to sunlight. And that little nugget of information was taken on board when there was some ward refurbishments happening, in that they positioned the beds near the windows where the sunlight would hit the beds. So that was one instance.
And did that start from a literature search as well, Sam?
Yes, all the posters on the database started the literature search.
Interesting.
Either we do the search for them or they do it themselves, but sometimes when they do it themselves, they come to me for training before to how to operate the databases, and as part of that we get talking. Mm-hmm. And then they say what they're doing. Sometimes it's college work and so forth, and other times it's this, and then I bring, during those sessions I would bring their attention to the fact that such a database exists. Would you like to add what you've done to it? And they're always very pleased to do so. Especially now with revalidation and CME CPD, they always need to have proof that they are keeping up to date with their professional competencies.
So one question that's come through from one of our participants, there are two questions that have come through actually, but this one's quite relevant at this point. I'll pick the other one up a little bit later if I may. Does the database indicate whether a literature search was carried out by the library? Is there actually a field on the database to indicate that? No, but okay. It's a given that all the references on there come from the library. Right, okay. And what are your future plans for development of the database, Sam?
So we are taking this to the next level and making all internally produced content discoverable. So that would be policies and procedures. Then within the trust there are grand rounds and teaching sessions that take place where the consultants and the professors have master classes for the juniors. There are poster slides presented for all of that. So we're going to be starting to collect that as well. And also people now do produce videos of their learning. Sorry, carry on. Sorry, I was going to say, do you think you'll have to make many modifications to the database to encapsulate all of that variety of material, or will what you've designed pretty much be able to take that on board? What we have is pretty much able to take it on board. So this sits on our intranet, and our intranet has a whole lot of capability that we were not aware it could do. And it's only when I was working with IT to create the initial database, it was a journey of discovery for them too, to realize that we had, in effect, a Ferrari, but we were using it like a Ford, you know. That's the only analogy I can give. So yeah, we're discovering that we thought we had a Ford, but actually we've got a Ferrari.
Fantastic. I love the idea of a Ferrari database or a Ferrari intranet. Yeah. Wonderful. What do you think you might do differently if you set it up again? Nothing differently, because it all worked out just perfectly. There were no hitches, no bumps. Once we got going, it just picked up momentum, and everybody was going along with it because they saw there was value in it. That's really interesting, isn't it? If you can persuade people it's valuable, they'll be willing to take it on board. And I suppose because you were willing to put some time and effort into helping to get it set up, yes, and keeping it going, yes, there was not a huge investment of anybody else's time, presumably, in actually maintaining the database. No. So one of our library assistants is trained in updating it, and per poster, it literally not more than 10 minutes per poster. So the posters come to us in a variety of ways, as Word documents, PDFs, or PowerPoints. We had to turn them all into PDFs, which is quite easy to do because you do file save and you can choose the option to save it as, whether it's Word, PDF, or PowerPoint. We then upload the PDF onto the back end of the intranet and then make it discoverable by the front end, which I will be showing you in one of the slides. So it's quite simple to do. Brilliant. Also, another question from our participants is, how many records are there on the database at the moment? We have about just over 60 posters. 60 posters, yes. Lovely. So sort of 60 records at the moment. However, this database has only been in existence for a year. But what people did was they sent us the posters. So though this has only been in existence for a year, we have posters going back to 2015 because people sent us stuff they had done before as well. Or retrospectively, yeah. Yes, exactly. So initially, yes, to get all of that uploaded was a big amount of work, but then it's ticking over now, and 10 minutes per poster is what it is. And these competitions are annual, maximum 10 posters per competition. Right. Okay. So it's quite a manageable thing. It's nothing that's going to take you away from your business as usual. Brilliant. And do you get involved in actually helping to create the posters as well, or beyond doing the literature search, or is that really then the remit of the researcher or the clinicians to design and produce their own poster? It's down to them to design and produce it. Lovely. And their creativity goes into that as well. Also, it depends that they are producing these posters not for the database, but for other audiences. As well. So, and if you're presenting at a conference, then there are certain ways that you have to present for the conference and so forth. But everything becomes a PDF eventually, and the system can deal with it, however it's laid out. Wonderful. And are there other benefits that you feel your service has benefited from managing the database? Have you had sort of extra benefits? Oh, certainly. The library now, previously the library was looked upon as a little side office somewhere, but now we are very much center stage on what happens here in the trust. And also we are seen as common ground for all the different professions who practice here. So there is not the, the library is equally accessible to a nurse or a doctor or a physio or a porter or a healthcare assistant, and they don't have to worry about
encroaching or sometimes there are these hidden, invisible boundaries that people don't want to cross. But when they're in the library, there is no such thing. We're here together and we're working together.
That is interesting, isn't it? So it's kind of put you much more centre stage, which is lovely to hear, isn't it? And just by doing this one thing, that can make such a big difference in getting you known.
Yes.
So another question that's come through is, do you know how many staff across both trusts? Is it equal between the two trusts or the two sites that people are contributing information, or does one site contribute a little more than the other site?
It's pretty much equal because we have this competition between the professions, but also cross-site.
Oh,
well.
Okay.
Yeah. So that is something that has developed. That wasn't the intention, but it's healthy competition, and healthy competition is always helpful, I think.
I quite like that. I'm going to make a note of that. Healthy competition is always useful.
Yes.
Wonderful. And what three, if we were sort of giving some advice to us, what 3 lessons did you learn from doing this that you would want to share with us, Sam, in particular?
I think just do it. It's going to be it was fun for me. It's going to be a fun journey. You meet some very interesting people. You get to see things from different perspectives, and that helps you to understand your role as well, because as librarians, we play a supportive role to the clinicians. So the better our relationship with them, the better we can cater our services to fit in with what they need as they deal with the patients.
Lovely. That's really helpful. Thank you, Sam. So I've got another couple of questions that have come up. Probably take those now, if that's okay, Sam, and do keep the questions coming. So I've got one which is a clarification on what I asked earlier. So I asked whether both sites actually contributed to the database, but actually what was meant by the participant was actually how many staff are actually contributing. Do you know roughly that figure?
Well, say each poster could be done by an individual or by a whole group of people, depending on the complexity of what they are tackling. And again, I will show that in the demonstrations slides further on. So we're not. I mean, I could do. I've not done a count up of how many names are on there, but we could do. We could do that.
Okay. And how many staff are roughly in your organisation?
Has joined the meeting.
I'd say about 3,000, but that includes everyone from consultants to porters and all the admin staff as well.
So that would be your total staff, yes.
Yeah.
Lovely. Okay, so questions coming in thick and fast now. So more of a comment, sort of a comment really rather than a question. Somebody's thinking here that actually if the database did indicate that the library did a literature search, it was very explicit, wouldn't that demonstrate the impact of library literature searches to the trust? But I suppose that's implied from what you said anyway, because nothing would go on the database unless it had a literature search. Is that correct, that understanding?
Exactly, yes.
Lovely.
Because the library resources, it ties in with the CLA agreements with NHS England and the CLA to be able to use library resources for conference presentations to share with us. So all of that kicks in as well, so people know that they need to use the library resources to be covered by the copyright side of things to be able to then present their work outside the trust.
That's an interesting take on the copyright side of things, isn't it? And actually putting the library centre stage to help with that type of thing.
Exactly.
Another question I've received is the database standalone or does it link into other systems within the library?
What other systems did they have in mind?
I'm guessing they probably mean things like maybe the library management system is one that would come to mind immediately, I'm guessing.
Yes. So if a person now does an OPAC search, along with whatever books are available on that topic, they also get the innovation posters popping up.
Oh, fantastic! So it's actually listed as a separate, an additional resource within the OPAC. And is that, do you have to create separate catalogue records for each of those items on the database, or is it somehow? Sorry, you can tell my technical ignorance here. It's sometimes wedded together.
What we did was downloaded an Excel spreadsheet off the intranet and then uploaded it onto our OPAC.
Fantastic. Okay. So I've got a question here, and this is somebody who asked a question earlier on, so I'm going to take these two questions together. So the first question they asked quite early on when we started, I'm just scrolling up to find it. Prior to creating the innovation database, did you have discussions locally about how you defined innovation? And is that something that you could share if you've got the outcome of what actually is meant by innovation within your trust? Is that something you can share with us?
Yes, so innovation means something that they're doing something for the first time that hasn't been done before. So maybe something exists outside the trust, but then somebody has made it available or is doing it within the trust, and it has not been done in the trust before or in that department before. So it's something new, changing how you do something.
Right. And we discussed this in the project group quite a lot, didn't we? And we were aware that there was some national innovation database, and that's why we also focused on best practice for trusts and what was working well for perhaps an individual unit, so they could share that with other, maybe an individual ward, so they could share that with other wards across the organisation.
Yes. So innovation could be that somebody came up with an idea and said, let's do this. And then also what they do is when you come up with an idea, a literature search shows you is somebody else out there doing it already, and you can learn from their experiences. Or if nothing comes up in a literature search, it usually means you're innovating within, it's a primary innovation, I suppose. So, yeah, I mean, that way you can see if somebody's already done it, it's easier to put it into place because you have the literature base, the evidence base that shows that this is a good thing to do, so let's do it.
Lovely. And sort of associated really is, what was the primary outcome that you were looking to achieve with this innovation database?
To make information discoverable. These posters have very useful information. And it comes out for a competition, is up there for one day, and then it disappears forever. So this way, we've captured that, and it's available to everybody who, beyond that one day, that it's on display. Lovely.
Yeah, that's super. Sam, I'm sort of conscious on time. We've got two options now. You've answered all of my questions beautifully, and many more that have come through, and I've got a much greater understanding of how you've gone in and created this database and the reasons for doing it, and some tips really on getting support from people and adding the competition element, I think is all very interesting. Shall we move on and have a look at the questions you presented, or would you like to give us would you like to go through the screenshots now so we can actually take a look at the database, and then perhaps we'll come back and try and answer some of your questions now and any more that come through from participants?
Yes, that's true. I perhaps maybe too the question can be from the participants, because presumably you're here because you want to do something similar, and in your environments you may have issues that are unique to you.
Lovely.
Which you can then air, and we can all see what we can come up with as solutions.
Okay, so what I'll suggest then is keep sending your questions through on chat. I will field those to Sam as she goes through describing and talking to us about the actual screenshots of the database, if that's okay. So I'll move you on, Sam, to your first slide. I think you can probably move these on yourself as well when you need to. Okay.
So we'll come back to this, and we can move on to here. So this is the database. It sits on our intranet. This is the main intranet. That's your breadcrumb trail. So we are in the RBHT Innovations database. And on the left, the title and description at the bottom, the title column has the title of the poster, and that is what is hyperlinked to a PDF document. You click on this link, and you can open up the PDF. The description is what it's about, and you can search for items by keywords. So it says here all categories, but because this is not like a literature search where you're building a search, this runs more like Google, as in you put in your keywords in a string and search, and if those keywords exist in the description or the title, it will bring up, that would be what your search set would be. So you can search by author name, by year, by clinical term. You're free to define how you search.
Lovely. So one question, or two questions that have come through that are related. Just to clarify, you only have the posters listed on here at the moment. Is that correct?
Yes, so posters, present. In my slides below, I've only shown you the posters because there are other reports and so forth that are a few pages long, which wouldn't have displayed very nicely on there.
Of course. So you're not using it currently to display journal articles that staff have published or abstracts from PubMed of published articles at all?
That comes through on our OPAC. So on our OPAC, this feeds into the OPAC. Any research documents, as in published research documents, feeds through onto the OPAC. And then we're going to be putting educational stuff and videos and so forth. So, yes, our OPAC is the next level. As a result of this and the trust saw the value of this, I was allowed to invest in a OPAC system that would then make all our content discoverable.
Is that actually a discovery system, Sam, or is it actually just an extension of your existing library management system catalogue?
So our library management system, we had a very old one that was installed in 2001, which we've been using all these years, and we started getting error messages on it saying our database is inconsistent and we could lose our information. So that kind of coincided with the creation of this database.
Ah, right.
So it came to the point where we had to decide to invest in a new one. And so that conversation and this conversation, the conversation synchronized, and I went to SILIP, had a LMS showcase event last autumn, and I'd been to that, and I'd looked at, so I was looking at the showcase in relation to everything that I needed to achieve, and I found one that would fit the bill. And
are you happy to share with us what you purchased? Which system?
It's a system called Genie Plus.
Right.
From InMagic.
Lovely. Thank you. Of course, other sellers are available. Yes. Thank you.
Yes. Of course. Here we go. So that's our database here. So this is the database that sits on the intranet. This is not our OPAC. This is just the database itself. So here we go. So here's one of the posters, but this was done by a clinical nurse specialist, so one individual. A very quick service improvement. That's what the service improvement objective is.
Melinda has left the meeting.
And the tools used are, quite simple: feedback sheets, observation, and so forth. The next slide. That's a bit more complex. There's a whole lot more people involved looking at issues. There we go. That's what it's all about. So it's a poster, but this took a lot longer to do than the first one.
And do you write the abstracts that go onto the database? So you said that when you're searching, it will pick up on keywords in the title and the abstract. Do you compose the abstract for each poster, or is that something that the people submitting compose for you?
The people submitting compose because they have a better feel for what's important.
Right. Okay.
The keywords that are important from their perspective.
Yeah.
This is a simpler one, basically to ensure that patients are adhering to recommended levels of activity, and if they don't, then the condition deteriorates and they need to do certain things to get better and so forth. And so that's what they're looking at, to see what is actually happening and what can be done to improve patient engagement with what they need to do in their care.
Now, obviously, for the purpose of this, you've blanked out the name of the person that's produced the poster, but would that be the lead author, that if somebody else was interested in adopting this innovation,
yes,
that's the person they would contact, presumably using your internal mail system?
Yes. Yes.
Lovely. Yeah.
Exactly. And all posters have this reference section here, and that's a literature search, or they've used the library resources themselves to find what they need.
Right.
And all the posters have that. They have to do that. So that is showing that there is library involvement, either through a literature search or they've looked at it through their Athens account and found it anyway.
Another question that's come through, Sam, is
yes.
Do you have guidelines for staff who may be submitting innovations that have commercial sensitivity?
Yes, so I've not shown any of them here. There are some, and there are commercial sensitivities attached to some of them, and that is the information is on here, but we don't look after IP and so forth. There is a department that handles all of that.
But they that department don't have a problem with those perhaps commercial sensitive projects being shared within the organisation on the intranet using the database?
No.
Lovely. Thank you.
That's all right. And then here is a very, very big project, as you can see from all the names are blanked out. And again, addressing an issue that was costing the trust a lot of money. And of course, the changes that they did, and they cracked it, as they put it. So this is a lot of work, and they love to be able to showcase and share, and also that it can be transferable to other settings as well. And these are presented outside the trust. This particular one was presented outside the trust as well, and this is a A3 poster, but not landscape, the portrait. So again, at the very bottom of this is a whole list of references that they've used.
Did you find, having set this up, Sam, that you had an increase in demand for your literature searching service?
Yes, both searching and Athens accounts, and we also have a system where people can access our resources 24/7 remotely as well. Mm-hmm. So once a person's had a literature search, I find they tend to teach their colleagues. So if I teach one person, they in turn teach two other people, and there's a cascade effect there as well.
Fantastic.
Yeah. And this one here is a presentation at the ESC Congress in Rome last year. Again, something that was trialed here in this trust.
Has left the meeting.
So these are the sort of things that we put on our database.
And you said there are also, you didn't use any of those examples, but also papers that people have written or some internal documents around education, that kind of thing has been included as well.
Yes, there's a separate database for that. That is not innovation. That is, we call it our educational database.
Okay.
So as a result of doing this one database, we've been asked to do databases for all of these other things, and then we make it all discoverable on the OPAC.
Right. Okay. That's really clear. Thank you, Sam.
You're welcome.
Do keep questions coming, participants.
These are questions that have come to me, or that I felt that as I was talking to people, librarians, about what I've done here, that they feel they can't do it where they are because. Mm-hmm. So these are some questions that could help to look at the issues.
So what do you think would be the challenge to setting up something similar to what Sam has done, and how do you think you could overcome that? So feel free to click on the T tool and start to type into the whiteboard anything that you think as participants might be a challenge and how you would be able to overcome it. Getting help from IT would be the challenge, and getting buy-in from influential members of staff. And somebody else has put technical capability, working with IT. In terms of getting people engaged and on board. Sorry, this has gone off the screen. This often happens, unfortunately, with WebEx. Need conversations, I think, probably with the right people is probably the thing to think about. Convincing other departments. I think that's true. You need to have your champions, and I think Sam was very successful in having her champions at her education board and medical education committee.
Yeah. Prior to going on the leadership course, which resulted in the database being created, we had a lot of engagement activities going on the 3 years prior. So the library would go to the clinicians with they had their training days, their CPD days, and I used to do the rounds with them in there. And this was sometimes very early in the morning as well, 7 o'clock, because they have their training, then they start their clinics. So I spent all of that time doing the rounds on both sites, publicizing the library. And funnily enough, that was the stepping stone to achieve the next one. And while I was doing all that engagement work, I was my primary purpose of that was to say, here is the library, here are the resources, you need this for your work, so use them, and this is how you use them. And that was the purpose behind that, but then that was a stepping stone to the next thing, and the next thing.
Thank you, Sam. So a stepwise approach seems to be a good way of doing this, and gathering champions and supporters along the way, and then sort of presenting it as a sort of an additional thing that you can offer. Being clear on the parameters of the database is one thing that's come up, and how it relates to other resources, and convincing other departments of the value beyond the library. And the challenge would be getting people engaged. I think I've mentioned that already, and finding an appropriate platform. So you said that you approached your IT department about the platform and about the intranet, and that they weren't aware of the ability of the intranet to host a database. Is that correct?
Yes. One of them said the library is the only department that's getting them to push the boundaries of what they because they were simply using the intranet as a notice board. Interesting.
Okay. So there might be some capability with interest that is untapped, we just don't know about. And I suppose if not, you've said that you've used your OPAC to good effect as well, so there might be other ways of being able to present this information, perhaps using other existing systems maybe.
Yes.
But mindful, I guess, of the question earlier about commercial sensitivity and IP, when most OPACs tend to go, be outward-facing beyond the organisation. So that may be a bit of an issue to be aware of. Yeah.
All of our systems are inward-facing, and at induction, all staff have to sign a disclaimer saying that what's inside stays inside.
Okay. So that's maybe something around the pro. Okay, so I'm just going to. I think that's most things that have come out. Engaging IT support to build and host the data. That seems to be a common theme, actually. Getting support from IT, getting the technical stuff right, and the engagement. So I would suggest having a look at the report that was produced by the project group around ideas for engagement, obviously taking on board Sam's idea of step by step, and probably getting support from IT. It's just about having those conversations, I can imagine, is probably the way to take it forward. There is actually, within the model that we produce, there is a technical specification for a database that Tim Jacobs pulled together. I'm afraid it went over my head, but I'm sure for people who are very technically literate, it may be very helpful. So that might be a place to begin a conversation.
Yes, you could show that to your IT people. Mm-hmm. And also, if your IT people in other trusts want to connect with our IT teams, that is possible also.
Oh, that's brilliant. Thank you, Sam. That's really helpful. Okay, so I think we'll probably bring this WebEx to a little bit of a close. I'll just go back to the slides and just move us forward. Don't forget to revisit the questions from Sam after the webinar, because I think there's some useful pointers there. And obviously you can look at these slides in more detail and look at some content from the database, which is also quite helpful. I don't think we've had any more questions through, but thank you for all the questions that did come through while Sam was talking. That was really helpful to keep this relevant. There are some links here for further information. So you've got a link to the Knowledge Management Toolkit, a link to the final report of the Leadership Project Group, which gives you lots of tips and tricks on adopting knowledge management tools and techniques, and also a presentation that was given at eHill, again looking at getting started with knowledge management. So there might be some pointers there to help you get started. It just leaves me to say a really big thank you to Sam for joining us today. It's been absolutely fascinating to hear what you've been involved in, and I've had lots of lovely comments have come through as well, lots of thank yous, and people have found it very interesting. So just as a final sort of participatory activity, you'll see in your participants box a little tick and a cross. I'd just like to know, having heard Sam's experience, whether you now feel this might be something you might want to take forward in your trust in terms of actually speaking to IT, trying to get some champions on board, taking a step-by-step approach to perhaps creating an innovations or a best practice database, something you're going to investigate. If you don't feel able to at this stage, a cross would be good, but if you do think it's something you take forward, just pop a tick alongside your name. So quite a few ticks there, a few crosses, so people are still not quite in the position where they feel they could take that forward at the moment. And that might be worth exploring perhaps collectively as a group as to how we can support each other to take the work forward. As Sam has said, there's help and assistance from Sam's IT team, and Sam herself, I'm sure, would be happy to. Is that okay, Sam? You'd be happy to field further questions if people had any comments or questions?
Yes.
Lovely.
No problem.
Okay. So thank you, everybody, for listening today. Thank you for joining in and for bearing with us through our slight technical difficulties over sound. Please look out for details of our next webinars. We have 2 more to run, one on knowledge assets, connecting people to knowledge. The date's yet to be confirmed on that one. And then watch out in mid-December, helping people to keep up to date, alerting services. You will have noticed from the Knowledge for Healthcare blog that there's been a lot of work done on this. There's a post up there that was posted last week about alerting services, so I'd urge you all to have a look at that. And please join us in mid-December to find out a bit more about how to get involved in that work or benefit from it. Okay, thank you, everybody, and have a lovely day.